Hello, listeners. Welcome to the Among You podcast by Kuchu Times Media Group, a project supported by Uganda Key Populations Consortium under the Free to Be Me project. It is aimed at demystifying the myths around LGBTQ plus Ugandans by sharing how similar the Ugandan experience is, regardless of your gender or sexual orientation. We hope that these stories build allies out of you. Enjoy. Human beings are different, but similar, but different. There is a misconception that LGBT persons have a whole completely different life or experience, which is true, but there's also things that we have in common with everybody else. The only difference comes with sexuality. Kuchu Times Media Group is launching a project called Among You, a podcast aimed at sharing the experiences of LGBT Ugandans with the aim of showing the general public how similar we are, hoping to build allies and also to demystify the myths that are spread about LGBT Ugandans from the propagandists and the peddlers of homophobia. Hi, my name is Samantha. I'm the editor at Kuchu Times Media Group, and welcome to the first episode of the Among You podcast. I have interesting people with me today, and I'd love to let them introduce themselves.
Hi, my name is Bana. I do random things here and there, but I'm interested in AI art. I'm interested in graphics. I'm interested in music. I'm interested in nice things that are nice to look at. Yeah, so I'm your guest today. My pronouns are he, him.
And I'm Miss Lamon. I'm a social worker, queer person, mental health advocate, and a counselor, and I love several things.
And I'm Sean. I'm a farming activist and so many things along that spectrum. Good to be here.
Did you say you're a farming activist?
Yes.
What do farming activists do?
I farm while I do activism.
Oh, I thought you farm for activism.
It depends on which side you look at it. It could be both. I could do the farming for activism, but also farm for...
I thought you were an activist for farmers.
No.
Yeah.
No. That would be a farmer's activist. I'm a farming activist, not a farmer's activist.
A farming
Activist, yes.
Okay. Anyway, so today we're going to have a conversation around healthcare, specifically our experiences. And I think the first question I have is, have you ever had to disclose your sexuality when you've gone to the hospital?
Sean, you want to go first?
I think I'll go first. Yes, so I think this has changed along the years. When HIV, let's say, programming had just started in the country, that is around 2013, 2014, 2012, around that time, yeah? So there's a time you would go to hospitals, and every time you reach there, you'd be like a tourist attraction. So the first person you interact with would, call live in a room and then go call another health practitioner to come and see, the kind of different person you are. But that has, over the years, changed. Of course, it comes with a lot of the advocacy we've done, a lot of engagements with different stakeholders, and getting people on board to work with us as a community. So I think that is where the change for me has been realized, really, mostly.
For me, I've never had to, but I do remember an experience going to a clinic somewhere in Unyonyo. And I did my service, I got my service as well. And then there were two ladies I was sitting on the bench with the whole time, like we were in the line together. When I entered, I said, hi, and I just put on my headsets and yeah. So after getting my service, as I was coming out, they approached me and they said, I don't know if I'm allowed to use Luganda. So they said, obwedda tukulaba nga twebuuza oli muwala oli mulenzi. You are so beautiful. Oli mulungi nnyo. Oh my God. But it didn't sound so negative in the negative sense, but it sounded like amusing for them that I was so good. And then she said something that even you're good looking, that's why you have pins. So that is when Sean was talking about like how people perceive you in the hospital, in the health facility. I just remember that incident because I didn't have to show like my gender or my sexuality or my expression, but they were like, "Oh my God, you're so good looking and you have nice hair," and yeah, that has been my experience. But overall, I've never had, as a gay man who sort of passes, I've never had to disclose that I'm gay, unless if the issue that has taken me there involves being gay. But even then, I would figure out a way of bring it out without disclosing my sexuality.
Personally, I haven't experienced anything. Praise God. But also as a person or a social worker who works with different individuals, I have been able to interact with people who are masculine presenting, who have to go through the trial, just like Sean actually explained or what they went through. And also those who actually struggle with diverse ways of expression in their way of dressing. Usually you find some of us females want to dress in a masculine presenting way or in a way that is different from the rest. Like, for example, my mother would say, if you pierced your ears, then you are so and so. If you have a tattoo, then you're so and so. So because of that conservative nature of thinking, we've had different people over members or people in our community go to different health centers, and every time they are seen as a stereotype, actually that goes back to the recent propagandas that is bringing about the homophobia. We keep having different stereotypes that actually just block us from accessing services, especially the health sector. So the people we interact with or that we work with and assist or serve in the community usually go with the struggles. They have to actually put up a certain pictorial expression that is acceptable to society to be able to be served, or else oli musajja, oli mukyala, ogwawa, oba oli bino ebintu bibali okwogerako. So there's usually that shortcoming with people who actually express themselves differently as per societal norms. So those are the experiences that I know that I can tell. Of course, I'm not obliged to give the specific details, but it's been a terrible experience of whereby, who are you? Who is your husband? How old are you? Like, there are these questions, and then a person ends up going back home, and guess what happens? You're on survival mechanisms that are unhealthy. That's where the drinking comes in, anything that can be able to make you feel a little bit less painful in regards to the unacceptancy. So that's the experience that I have.
I think for me, it has happened once. Okay, not once. I struggle with that question of, so I have, how do I explain it? I have a messed up reproductive system. And so I find there's a time when I'd like really miss my period for so many months. And then I go to the hospital and the doctor is very, very, very serious that I'm pregnant. And I kept on telling him there's no way I can be pregnant. And then he asks me, are you sexually active? I said, yes. Then you're pregnant. I'm saying, I'm telling you there's no way I can be pregnant. And like, we were in the room for the longest possible time with this whole back and forth thing. He forced me to take a pregnancy test that I refused. He said, and he was giving me a whole lecture of how condoms are not as foolproof as people think they are. So I could be pregnant and it doesn't. And then I kept on looking at him. And when we did the test and it was negative, he's like, oh, so you actually know your body? What? Like, I've been trying to tell you this thing the whole time. Like, there's no way in hell I am pregnant. But then because I did not feel like it was, of course I would have cut myself the time of the price of the test, or even the back and forth in the doctor's room, but just simply telling him I cannot be pregnant because I'm a lesbian. But then I didn't feel like something I could easily say. I didn't feel safe in that space. But I think that's the one time that I've actually had to, my sexuality has hindered service provision to me, which has been difficult. I think that's the one time that I went through that experience. And even then, interestingly, I was prescribed contraceptives because apparently they're hormone something. So yes, but I was just thinking about the fact that the people that actually do not have understanding partners. I'm thinking my partner finds me with contraceptives, and then I'm explaining that it is to like, and then because there's not even that much information about women's health in general now. Yeah. There's people are not, they don't know. Yeah, no, like, leave alone no queer women or whatever, any woman in general. Women's health is a very big blur. Most people are just gambling as they go. And so in that process for me that day was when I said, yeah, and I'm so glad I've not had to experience that again.
Yeah, there's something I'd shared with you earlier around a similar issue of misdiagnosis. I had this weird thing where I would keep falling sick at school, and like I would fall sick, and every time, because the only medication in the canteen was malaria medication, they would just give me silly, and then like I would take Coatem and finish the dose, and it would not go away, and then somehow I would be better after some time. Like, then I would do it over and over and over again. Until I went, there's a time I actually did it, and then they said, now your body is resistant. We are going to give you quinine. And then they gave me that injection of a cow. It's a big fat, like when they inject you, your butt gets really swollen. And it's like, I don't know what is in that thing, but it makes you so weird. Yeah.
They did not. Yeah. They did not trust. They would give you that thing, and they put a bottle in the fridge, and they massage your butt.
Yes, that's what they say. You massage your butt.
Most of our asses have those ditches or swollen things.
Yes, but thank God I did it once, and I said I'm not going back. So, but even the quinine sort of didn't work. It made things worse. So there was a time I think it was during my mock exams. I was starting to like lose focus, like with school and everything, and I kept falling sick a lot. So they sent me to a counselor, and the counselor it was an actual psychiatrist, so it wasn't even a counselor. And they said that whenever you're stressed or whenever you think about like things that you have to do, you sort of take your meals or everything on the back burner, like you stop eating, or you eat less, and so your nutrients are drained. So that's why you like keep falling sick. So he told me, he just gave me supplements and said, okay, go home, come back every 2 months and get some more supplements. And from that day, I never had quote unquote malaria. So clearly the school nurse was unprofessional, but I felt like I was so violated. How do I get quinine for nothing? I was so violated. And all that time I'd spent taking all that Coatem and that weird milk. Of course, it helped me to miss morning prep, but it's
a win.
Yeah, I win, but still, that injection is painful. Yeah. Mm-hmm. So I think personally that is a case that I got for being misdiagnosed in health care. But I'm curious to know what other people have they ever been misdiagnosed, maybe because of their appearance or because of like the way they look.
I think I'll share. I have an experience that just came to memory now. It's an experience of a trans woman who, just listening to Samantha's story, how she went to the doctor, and the doctor is like, you're pregnant. So this person goes to a health facility, and they have, I don't know what they had, but they reach the health facility and the doctor is sure and certain that this person is pregnant. And this person is a trans woman. So that process of, you know what certainly is going on in your body, but you cannot open up to the health practitioner. And then you spend a long time with this practitioner in the room trying to see what line you're going to both reach to agree that, you know, that you get this service or you don't. And then also maybe another very recent experience was a trans woman who just fell sick. You know, she fell sick and then she collapsed and she finds herself at a health facility. And the first reaction to this person was, oh, she's a woman. And then the process of putting this person on drip, they realize, oh, she's actually not quote unquote a woman as she appeared. So at that point, there was sort of lack of service, like the like provision of service was not given in that moment because decisions were being tried to, like, that moment of making decisions. How do we treat this person? This person has fainted. They are alone. And how do we safely, but then also brings in the issues of being discriminated on that basis because someone is looking at you and saying this person is not, cannot be registered within the system as they are. So yeah, those are some of the experiences maybe I can share in regard to transgender people.
By the way, didn't that story end really badly? That is not the lady that ended up the brain thing because they took long to give her treatment.
I don't think, because they actually she stays in hospital for a while, but she's not fine. She was discharged, and she, because of the drugs she had some sort of, but she got over it, I think.
But that gets me to thinking how for various reasons actually health practitioners will refuse to touch. I've seen people go to hospital and they say they won't touch them unless you deposit money. So
unless you have insurance, usually it is insurance.
That is generally a Ugandan problem. Like you see, it will happen to you as a queer person or a non-queer person.
That's what I'm saying.
It's just basically a Ugandan problem where you have
fancy hospitals.
Exactly, and we saw it during COVID, where those with money you will get the best services and the quicker services, and I think that's where this conversation actually does a line. Like, we as Ugandan as anyone else in terms of receiving services, how we receive them, it depends on your capacity to your financial muscle, really. Yeah,
because when you were saying that, it came to me. I said there are so many people, like there's so many reasons why people are denied healthcare in Uganda, and it's half of them are ridiculous, and so it goes to say that whether or not, at least one thing that the thing we're saying about similarities and differences, we are similar in the sense that we just have more ways to be discriminated against. We just have more ways to be, but everybody in Uganda, don't push yourselves. Discrimination will reach you.
It's particular discrimination in regard to access to health.
Yes, yeah.
Actually, most hospitals or most health facilities, I don't know who came up with this, but there are days when the doctor is around. Like on Wednesdays, on even government facilities.
If you ask me, I would say that as queer people, we receive maybe better services most times than.
Yes, because we have our own clinics.
General public, because we have specific health facilities that quicken these services for us, and then the fact that we know, we're also empowered to know that these services are free. It makes us easy to access some of these services in this particular. So it comes again with the sense of privilege. Like, the queerness comes with the privilege of you have access to this information. Then you also have access to you have the ability to exert your rights in the sense that makes you access to services even much easier than very many other Ugandans who don't have access to this knowledge.
I disagree with you though, because even within the privilege, there's, so you see, these things because you do the work. That's it's your job. But I don't think somebody. Did you know that somebody deep in my village, for example, me, I'm from Mukonji. Yeah. I don't think there's anybody. I don't think they know. Do they? The service.
A queer person in Rukunjiri may not know the service, but if a queer person in Rukunjiri got attacked and got in touch with you, you would quicken their access to service in that sense. If any other normal Ugandan got the same problem, they may take longer to access those services at the casualty. Let's say someone has been beaten, By the time they reach the casualty ward and get access to those services in our regular health service system, and in comparison to when, because you as Samantha know this information and a queer person has contacted you as a crisis responder or whatever capacity, you're able to connect or refer them to the nearest health service provision that is KP friendly, So that makes it like that referral in itself comes with a privilege, comes with an upper hand, upper than so many other common Ugandans in that same incident. If you got a queer person in that incident and another Ugandan who has the same problem in that same context.
For me, there's something weird. I mentioned that in Uganda there are days when the doctor is available, and the days when the doctor is not available. And if you happen to fall sick on Tuesday, wambiguma, paka Friday or wako Thursday, when the doctor is around. But then also there is this weird practice in hospitals where if your case is not as serious, they send you to the interns. Then they play on you and give you those weird misdiagnoses. Yeah, they first you go, you have a headache, and then they put all their little knowledge that they have just learned in their first year. Oh, it must be a migraine. Is it a headache? No. Is it an aneurysm? Let's do a scan. Yeah, it's an interesting thing about being Ugandan and being in the health. I mean, if you are well-to-do and you can afford a private facility, then you do not have to deal with student medical interns, pushing you around. And also these are the same people who will the advantage with medical interns is they overly care about you. Because they are still passionate about their job, unlike the senior doctors. Those are even the ones who come on Wednesdays only. That's the advantage of the student people. But then still, you do not really feel like you get the real service, and I think it's also a bias of I know what's going on. I know that I'm dying of malaria or I'm dying of some weird disease. And this one is telling me my brain aneurysm. It's a migraine.
The stereotypes that we have of whereby if we see younger people, we don't think they're actually doctors. That's the reality. Way back, if my mother would take me to the hospital, if it's a young person, she'd say, I'm not sitting with this person until we get me a person who actually, with a description of gray hair or something, should actually describe the person. So there's a lot of stereotyping in regards to also how we accept our medical, persons in regards to also that disadvantage. But I wanted to, actually this was itching, I wanted to go back to Sean. Where you're coming from is correct, but as per my personal view, it's as to a small extent.
Of course.
Yeah, it's a small extent, because I swear to God, you put it to a larger extent, me and you are going to go in the tussle and something. But still, I'm also referencing back to Samantha and what she said. Yes, we are in this field. We have the luxury and the privilege to work with people, to serve people, to actually know this knowledge, to extend, to work with even remote areas. But the reality is, let me give an example. Kampala. There are places with nice roads. They're focused on them. They built those roads. You understand? And there are places whereby it's dust. Oyimba chairman dust. So in the center, by you understand? So the same thing is it's like us. With that privilege, we've been able to touch hearts and places, and also we've been able to be touched. But then the fact is, we are still mildly influenced and still taking the journey, starting from the poor have said the path. Yes, amen, thank you. We are still pushing through with our own flaws, but people deep down still lack that luxury. So I was coming from a state that I wanted whoever is listening to keep in mind that it may be to a small extent that we've had this privilege, and yes, we can be able to network and take through all that we've been able to do courtesy of the activists, HRDs and providers, but there's a large portion of us that is still ignorant and unaware about these services. So we're still actually on the low, not on the low, we're still struggling with the health system and actually other social services.
What I was going to say is that one, yes, what you said, the person has to know a Samantha. So those that don't. But also I remembered
privilege.
I remembered something. So when I was young, my uncle was an ambulance guy in Mulago Hospital, and every time I went to hospital, I would call him and and just so it helps to know somebody, I guess, anywhere. I would hear people say Mulago is bad, Mulago, and
you've never experienced the badness of Mulago.
I'm here, I'm humping my chest. I'm saying national referral. How? So it helps to know someone
Again,
somewhere.
it's a Ugandan thing.
Yeah.
You know you have to know someone to get things done.
Yes.
In a quicker and more efficient way sometimes.
Everywhere.
Yeah.
I don't know anybody. I don't think there's anybody in Uganda who can. You people, by the time we need connections to get national IDs. National IDs.
Uganda.
Yeah. So I think our time has been spent well. I'm going to start with the parting shots. My parting shot is I think healthcare is shitty to some people, to the non-privileged, and to the privileged it's somehow less shitty, but still shitty. And it is bad for all Ugandans, whether you're queer or you're not. And we just have to figure out a way to live with the misconceptions, to live with the incompetence. Banange. Personally, yeah. I feel like there is a lot of incompetence, and we have learned as Ugandans to put up with incompetence. When you mentioned the roads, I feel like, yeah, we've learned to move on with the incompetence and sort of survive with the incompetence. Yeah, so that's my parting shot. I think my parting shot is this whole weird healthcare thing. We face it the same way, although us it's more tweaked in a discriminatory and stigmatized way. But on the baseline, there's still those bad things that just happen in our facilities.
Healthcare is shitty.
Yes.
You said it like 4 times. Healthcare is shitty.
It has to say that. For me, my parting shots are, as queer people, yes, there's like the word health, access to healthcare sounds so nice, but what are we actually accessing? HIV services is not the healthcare that we only need. Yeah. So if we could, when you were talking about healthcare, I would honestly say we don't have access to healthcare as queer people in this country. We just have access to HIV services, and in some cases it translates into malaria treatment. It translates into skincare treatment, but
treatment for headache.
No, at Mapi Mulago Skin STI Clinic. That is a skin clinic. It is a national skin clinic.
Oh, okay.
So beyond HIV, TB, and STIs, how does I wish to invite us as queer people to think about what does access to healthcare actually look like for us, and also for our service providers and those people that work with us, implementing partners and whatever they choose to call themselves. Can we program better for our communities beyond, and also that also brings in the question of how, our community is included around disease. We are a disease community. Like, we are not included around our humanness or our need for access to healthcare, but because we're a population that is potentially has HIV or is going to spread HIV, that's why the interventions are there. We need real healthcare that is intentional, that is targeted, and that is tailor-made because as a trans person, I have different needs from a lesbian woman, from a gay man, from a bisexual person, and I think that is now the conversation that we need to have at that extent from here beyond.
My parting shot is from like I said in the beginning, or the purpose of this is to just highlight how we're all just going through the same thing. We're all going through it. There is, I would love for the people that listen to this to know that we could just work together and demand better from our leaders as a country, regardless of sexuality or gender. If, according to Banner's poem, healthcare is shitty, if we all come together and say it's shitty, and everybody is, because we have... and we have a lot we can pick from the queer movement, is that we've actually fought for our health. Although we've so far achieved sexuality, SRHR, but we can learn as a country that it's possible to demand for some of these things. It's possible to say that this doctor who only works on Monday, get us somebody, yes, get other people for other days. Like, what I just want everybody to know is that the fact that we're all going through the same thing as Ugandan, I feel like, and stop giving into these distractions, because how does a person living their life or loving who they want to love, how is you hating on them solving your healthcare problems, because we are going through the same healthcare problem. And so refuse to be distracted by I'm sorry to say this, but rubbish, and actually look at the real issues. Speaking of, Bana's very passionate doctors, are they the ones who are on strike? Are they the ones who are not working? The interns?
Yes, the interns are on strike at the moment. And yes, they are the ones who give you the most time.
for passionate people, why are they not working?
They are the ones that give you the most time. And also, like, I feel like now that they're on strike, it's even harder to get, because now the ones that are left are the ones of Wednesday only.
I didn't have a parting shot. You've said it all, but in regards to what's going on right now, everyone is facing things differently. And we can't say we relate because how we digest everything is unique. And all I can say is that there's help. There's help, and that is why there is presence of such podcasts and several more that are ongoing. So if you can reach out to any queer organizing or any allies or feminist organizings that can actually be able to help you out, please be able to embrace that without hesitation. Because that is in the way where we can have the privilege towards each other of having that connect of, I know so and so, they can show me which health organization can help me out. Because they know we're different and we are having a lot of traumatic situations that are actually holding us back from accessing that which is rightfully ours. So I wish and pray that you can be able to access those services.
I also want to invite us as queer people, but also as Ugandans, to be involved in the politics of the day. Like when you're talking about, doctors striking, what is causing to doctors striking? Are we involved in things like, health financing? Do we follow these conversations? Do we follow budgeting? Like, can we get involved to actually maybe see how we can influence these things for ourselves? Because if the system won't support us to, to be involved in that certain way, I think we have to impose ourselves at the end of the day.
Thank you so much for listening to us, and can't wait to have you on the next episode. Bye.
Bye.
Bye. Thank you for listening to us. Catch us next time. And to follow this podcast journey at Kuchi Times Radio, find on our website at www.kuchitimes.com and all our social media platforms.